We can give people insurance, but if we don't use process improvement and lean methodologies to actually improve patient flow and eliminate waste in the doctor's offices, we've just shifted the weight from one queue to another. We've solved some problems, but we haven't solved everything. And that's where lean, I think, is still going to play a very important role in healthcare in this country and around the world. It's an absolutely natural question for the people in hospitals to scratch their head and look at you kind of funny and say, what are you talking about? We're not a factory. We don't want assembly line medicine. Now, a lot of people in healthcare have never been in a factory to know, a bad factory from a Shingo Prize factory. The assembly line medicine has, of course, negative overtones. People picture in their mind the Lucy chocolate factory episode. They think chaos and stress and dehumanizing environments. And say, well, we don't want that. Well, as a starting point, there's already a lot of stress and a lot of chaos, and sometimes dehumanizing environments amongst the staff and providers in the hospital. To be more like a lean factory, if you can help people see it, would be a huge leap forward in terms of quality improvement and staff engagement, and creating a better environment for patients, a better financial result for the hospitals. Why is it when surgeons go to start a procedure, why can they not start because the orders haven't been written, the lab results aren't back, or because they open up a pack of surgical instruments and part of what they need isn't there. And for the 5th procedure out of the last 5, that same instrument isn't there. These are the types of problems and frustrations where factory lessons and factory methods are very, very transferable. Now, this is an MRI exam room from a children's hospital. And it'll illustrate the story I want to tell you is an example, I think, of where some of the potential for lean healthcare is, and a story of how we're able to engage professionals in the healthcare setting and being inspired to do things better, as opposed to saying, we're going to go do lean. We see pictured here, one morning we were about 2 weeks into a new engagement with this hospital. We had done some initial training, we were starting to engage with staff and managers, uncovering what some of the problems were, trying to figure out what we were going to be working on. And the MRI tech pulled me aside. She had some free time that morning. She said, Mark, I want to tell you what happened yesterday. I barely knew her, and I was happy that she wanted to talk. And she said, well, yesterday we had a patient in the MRI. Now, this is a children's hospital. To get the kids to lay still, they're almost always sedated and strapped down in the MRI machine. And as can happen sometimes, there's a reaction to the anesthesia that the kid, just after lunch, the kid was getting sick. And so that was a fire, proverbial fire, on one level. Kid's getting sick, we've got to stop the scan, go in and make sure the kid's going to be able to breathe and that he's okay. So the tech went into the room, and now what you see, that horizontal strip, are some hooks. Those hooks were empty. That's where the suction tubes were supposed to be ready, if needed, for such an occurrence. So we have fire level number 2. Patients in distress, God, we don't have what we need. So MRI tech says she ran out of the room, went to the inventory cabinet, one of these high-tech gizmos that magically restocks supplies. But those, they never work because it's all dependent on someone pushing a button each time they pull something out of the cabinet. It's hardly automated. It's nowhere near as good as a Kanban system, actually. But, there were no suction tubes in the cabinet. So we got another little problem. So we went to another MRI screen, interrupted a case. Now if you're looking just from a patient flow standpoint, you screwed up 2 MRI rooms. You're delaying 2 patients. Oh, and by the way, there's a kid in distress. So they found the suction tubes, went into the room. Long story short, the kid was okay. Now keep in mind, I took this picture the next morning. I looked and said, trying to put on my best, non-judgmental, non-blaming. Well, why are the hooks still empty? Starting to go into sort of like 5 whys mode. And she looked at me, she almost started to tear up a little bit. She said, no. You don't understand. We don't want that to happen again. With it. I wasn't accusing you of not caring about patient safety, but it's clear we have a process problem here. We have a systems issue.